Hello, my name is Pam Quirk and I'm a retired nurse and I have been a volunteer with Harmony House for 6 years. We are so excited to have you as a volunteer on our team. Our mission is to provide quality, compassionate, end-of-life care to those in need. After completion of this program, you are required to answer the questions on the post test. Please refer to the volunteer training section on our website. Today's program is called Introduction to Harmony House and Hospice. The objectives are to identify what Harmony House is and who lives in our home, to define hospice, explain the difference between hospice and Harmony House and the services they provide, describe how we work together to provide quality end-of-life care. So what is Harmony House? We're a 501c3 nonprofit organization. We're what we call a social model home for the terminally ill. We are not a medical model. Our founder, Ruth Willimane, a longtime hospice volunteer, noted that especially those who lived at home, if they didn't have a full-time caregiver or they lived alone, once they were bed-bound, that they often had to go to a nursing home for safety reasons. And like most Americans, these people wanted to spend their last days at home, but that wasn't able to happen. And Ruth thought there's got to be a better way. So she started investigating what could be done to help these people out. We are not a nursing home, or are we in assisted living. We are a group home with a common denominator being that all residents have a terminal illness. Harmony House is a member of Omega Home Network, and this is an organization of social model or comfort care homes from across the country. Many have been in existence for like 30 years. So when Ruth started her investigation, she came across some of these homes. The first was Malachi House in Ohio. And since then, I myself have visited homes in New York State and in Michigan. So Harmony House volunteers and staff become surrogate family to our residents. The staff and volunteers do not wear uniforms. Many of us just wear a Harmony House t-shirt and regular our street clothes. We want to promote the sense of family, so we share meals together, residents with visitors, volunteers, staff, even the hospice volunteers and staff who come in may all eat or share a snack together. So the kitchen is a big dining area, is a big gathering place. Harmony House becomes the resident home while they are with us. Who lives at Harmony House? Well, all the residents who come live with us must have a terminal illness. They must all have a DNR or a Do Not Resuscitate order. All residents must be under a hospice agency or a PACE program for the medical management of their care. The life expectancy must be 3 months or less, though we found the average length of stay is usually 7 to 14 days. We focus on those individuals who lack a capable caregiver, live alone, are homeless, or veterans, and those who lack the support emotionally or financially for quality end-of-life care. Where do these residents come from? We get referrals from hospitals, nursing homes, in homes in the community, shelters, dialysis centers. We get calls from family, a number of places. We do have an online referral form on our website, but many of our referrals come from people calling on the phone, asking some questions, and then our Harmony House volunteers or staff would fill out the referral form. We also have an online application, and it's not too long, it's just a couple pages, which can be filled out by the hospice agency staff, the individual, or sometimes if they're coming from a hospital, the social worker from the hospital will fill out the form. Then we also have a pre-screen interview, which is completed by Harmony House volunteers to make sure that the potential resident is appropriate. We do not provide skilled services, and the potential resident cannot have any behavioral issues. So meet Mr. M. He's a 75-year-old African-American male, widowed. He's an Army veteran, history of alcohol dependency, but he's been sober for the past 10 years. He's been homeless at times, especially in the 1990s. He's recently living in his own apartment. He has no family. He has a few friends from AA. He was diagnosed with lung cancer a year ago, treated, and has been stable for 9 months. But now he's not responding to therapy, with increased shortness of breath, back pain, and the disease is spreading in his lungs and into his spine. He and his oncologist have spoken, and he wishes hospice care. So that's when we would be getting the call from either him, the hospital, or the hospice agency. So palliative care is a comprehensive care provided by an interdisciplinary team for patients and their families living with a life-threatening illness, where care is focused on alleviating suffering, promoting quality of life. What is hospice? It's the support and care for persons in the last phase of an incurable disease so that they may live as fully and comfortably as possible. Hospice is a Medicare and an insurance benefit for end-of-life care which focuses on the whole person. Life expectancy is 6 months or less. So someone who has been on hospice 4 or 5 months can then be referred to Harmony House because our criteria is 3 months or less. So we're really at the end of the life, end of the life term. So hospice provides the medical management, which means they provide physician care, nursing care, home health aid for bathing and grooming and such, social worker and chaplain services. They also have volunteer, occupational therapy, physical therapy, and they provide bereavement services for up to 13 months after death to the family or significant other. Hospice provides a plan of care, which Harmony House follows. We ask that the hospice get that plan of care to us within 24 hours so that all the volunteers and staff at our home know what's expected of us. And we utilize the hospice services as much as possible or as needed. Example, the home health aid. We would prefer them to come more often rather than less often. Hospice supplies medications, and most are in individual doses. They supply equipment. Harmony House happens to have all its own electric beds. We have walkers, wheelchairs, shower chairs, and such. But if we need like a specialty mattress, we will ask hospice for it. Hospice provides routine visits and emergency visits. They're available 24/7 for resident issues such as change in condition and medication concerns. How is hospice different from Harmony House? Harmony House is not a hospice. Harmony House is a home. We provide meals, supportive care, 24/7, just like if someone was in their own home. So think of it like you're in your home and an aunt comes to live with you. So you're not a medical facility, so your aunt's with you, and yes, you are providing different services, but it's not a nursing home. So we do not provide any skilled services. Any skilled services would need to be provided by the hospice for, like no injections. So even though someone may be a diabetic and had been on insulin, we could not take them to Harmony House till they were off the insulin. So another example is we have a volunteer on duty who happens to be an RN. She notices that the urinary catheter is clogged. Even though she has the skills to change the catheter, she cannot, and she must call the hospice nurse to report her observations, and then the hospice nurse must come and change the catheter. The role of Harmony House volunteers and staff. As I explained earlier, we provide hands-on care, such as bathing, dressing, grooming, providing meals. We will feed someone if they need it. We change them if they're incontinent. We transfer them in and out of bed, and we provide companionship. We observe, monitor, and report to the hospice. We don't have a medical record, but we do have a resident log where who's ever on duty, the direct caregiver, would write a note during their shift about what went on. Was the person in and out of bed? How much did they eat? They document on the medication sheet, because the direct caregiver does give medications as prepared and ordered by the hospice. So there's scheduled medicines, and there are as-needed medicines, like for pain or nausea and vomiting. The Harmony House volunteers and staff provide emotional support, a physical presence for our residents. Our goal is that no one dies alone or lonely. So we really want someone at that bedside, especially when they're actively dying. Harmony House always has a director on call 24/7 for issues regarding the home, such as sick calls or things in the home that need repair. The goals for our residents. We want quality end-of-life care, a loving, compassionate atmosphere, pain and symptom management with the goal of a peaceful death. We want our residents to feel respected, that they are important, and that their life mattered. Harmony House and Hospice work together to achieve these goals. We are all equal, meaning the direct caregivers are all equal in their role as the level of care provided at Harmony House, despite if someone's a nurse's aide, an RN, an NP, or have no medical background, but just have cared for others who are dying or have been trained by us to be a direct caregiver. We all offer something special to our residents, and most of the people that we have are volunteers. The only employees we have are the one employee who's on the overnight shift. We will have volunteers who come in during the night if for the vigil. If someone's actively dying, different people can volunteer for that vigil service. So please, if you see someone who's struggling and you have some helpful suggestions, please share. If you have a better way of doing something, we're always open for ideas, but we need to support one another. Our Harmony House volunteers and staff are advocates for what the resident wants and wishes at the end of life. We act in the best interest of the resident. We follow the resident and healthcare proxy wishes. The goal is resident peace and comfort, physically, emotionally, and spiritually. Ways you can help. All of us are individuals, and we all have different talents. Whatever that talent is, Harmony House can utilize it. Harmony House is a home. You think of your own home and all the tasks that needed to be done to support it. Shopping, cooking, cleaning, laundry, lawn care, gardening, plowing the driveway, as well as administrative duties, such as, someone's got to take the volunteer applications, get in touch with the volunteers, schedule the volunteers, schedule the employees. We also have a Meal of the Month program where churches, organizations in the community, just individual community members volunteer to provide a meal for 4 one time a month. Again, we talked about how we want mealtime to be like a shared event with family if the resident's up to it. So once a month they commit to making that meal. They deliver it to the home. So we need someone to help organize that program. We did have a regular group when we were open on Pendleton, so we do have a starting base, but that will be something that we'll be looking for. And we need people to help share our message with others. First, for volunteers, but second, we had not been charging for our services, so we really need to get support through donations, grants, and other funding. So anyone who can help with any type of fundraising would also be greatly appreciated. Training. So today's training is one of many, but there will be 4 basic trainings for orientation on the end-of-life issues, and this is the first one. We also have online safety training as far as fire safety, bloodborne pathogen, infection control, COVID prevention, and they're on our website under volunteer training, where first it's get involved, then volunteer training, and the password is volunteer. We do need you to complete post-tests after each training exercise, because that's how we keep track. And we need another volunteer to take those post-tests and log them in so we know who's completed training and who has not. We all want everyone to be equal on their basic understanding of end-of-life issues. Then you also will be given a tour and an in-person orientation as things get closer. We're trying something new with more virtual trainings. Again, we have basic orientation on end-of-life topics, and then going forward we'll expand that knowledge base with other topics such as spirituality, ethics, cultural issues at end of life, and things like that. And we're always open to suggestions on what trainings. If you notice something that needs some training, we're more than happy to do that. Or if you have those skills, then you could provide the training for us. So we're at the end of this program. You know, someday you may need us, but right now we need you, and that's our motto currently as we try to recruit enough volunteers so that we can reopen. And as I stated earlier, please answer the questions on the post-test that'll be on the website, okay? And then turn that into us. Thank you. Bye-bye.